when it comes to trigger point work, you're looking for a tight band of muscle. And when you feel that tight band, try to press into it. And when you press in, you can always ask them if it's tender. For those who do not work here and are watching this video, this is a perk of working here. You get to get free massages. You just have to be on video. So as I'm going to work down through the temple, and you're going to run through here, along there. You'll find that right in here gets a little tender, pretty tight. I like to slip in there and kind of sink in and compress there. You feel that?
Mm-hmm.
Already? Yeah. I'm going to try not to beat her up. So. All right. Our cranium wasn't too, those muscles weren't too tight, but see if we got any jaw stuff. So like I said, sink up and down in. It's a little tender, is it okay?
It's okay.
Okay. She's like, I'm going to be tough for camera. She gets bonus points for laughing at my jokes. So. And you might not find too much through here, but remember the anterior neck muscles can be affected by your jaw. Your masseter is the strongest muscle in the body. So an active release, you're going to get on one of those points and have them open their mouth. So open and then close. Good. And open and close. Make sure you're zooming in occasionally on some of the spots we're hitting. All right, now that we got all that in there, remember as you can work along the ear and then through here. I try to get on the occipital bone right here, a lot of headaches, so I want to work all along that. Usually you'll find some trigger points through there. So I'll do that, come under with my fingers, and I'll do a little pull. Now I'll start on the outside, mastoid process. I like to grip that process, tilt, push into the spine on the right side right now, tilt the other way, give the more mobility in the C1, C2 area. You get most of your cervical movement through the C1, C2, so we want to open that up a little bit. And a little tender in there and a little tight.
Yeah.
And then I also like, we're working near the spine through the C1, C2. I want to kind of get my fingers in this position and kind of walk my way in between the spinal process through C2 through C7. So I'm going to kind of come under, tilt. Use your palms to be the part that turns her head so that your fingers are stable and you're not overworking them. All right, the next position I want to do is putting your hand over hand like this and your thumbs come up. And this helps with the cervical spine, a lot of the forward head posture. This will help the curve situation. So I'm going to kind of hold her head with one hand, come under with the other. Now I got both of my thumbs up. You want to get relatively close to the spine, into that spinal process, and turn them in and out. If it's too painful, let me know, Jennifer.
Oh my god, I heard a pop sound.
Well, as long as it doesn't break, we're good. That is a joke. It's actually normal. Sometimes if you open up some of these joints, you'll feel the synovial fluid release. And then you can actually use both fingers and come up. Nope, you down. And down. And up. And down. Alright, next we're going to release the anterior scalene. Because I want her to still be an employee here, we're not going to do super deep. We're just going to show y'all where. So the first rib palpation will be right here. Your anterior scalene runs through here into there. So we want to get right on top. Do you feel that? A little tender?
A little.
Okay. Like I said, I'm not going full force with it right now. Go ahead and take a deep breath in. And relax. You feel a little more when you breathe in?
Yeah.
Okay. That's how you know you're right on it, and that's good. All right, now I'm going to have Jennifer look up towards me. So, yep, there you go. Then now deep breath. Feel a little more now?
Yeah.
Okay. And relax. And again. And relax. You would do this a few times. Try, and as you do it, you'll put your fingernails, not your fingernails, your fingers will slide under the clavicle a little bit. I should trim my nails a little bit more. I'm sorry if I'm stabbing you in these little spots. She's like, it's okay. Normally I don't stab my clients. Apparently only my employees. So, all right. Next we'll do a little of the SCM muscles. So you're going to turn their head. Now see how that props up for us already, if you can see it. Now if you can't see it, and you can't really feel it, have them lift their head up a little. So lift up just like that. There you go. See a little more. There. And now we got a good view on it. So we can do it two different ways. I can do more of the micro stripping trigger point way. Not much lotion's needed. Just keep it, try to hold it up a little. And then go down the muscle. When you find a little point, you can sit on it. And then go down a little bit more. I'm going across the muscle a little bit. And always, try to tell the client if you feel like you're getting choked, let us know. Because this is getting more anterior than most normal massages, but it is very helpful for people who've had like whiplash and stuff like that. So, all right. You can also, when you work that area, you always want to get right near the clavicle and sternum through here, because that's where that SCM connects. You have two heads to the SCM. So release it that way. Next, we're going to do some anterior scalene and medial. So one way to do it, you can press in here and feel around for the where it gets, you feel like a little hopper is what I call it. A little tight band right in here. And then I use my forearm and pull them towards me. You got a good view of it?
Mm-hmm.
Okay. And back. You can all, if you can't find the spots, because you're new to trigger point, sometimes your hands have to kind of develop. You can just kind of hit all the spots. So cover all bases. So yes. So I'm gonna come through here. Try to walk your way, C1, C2, C3, and all the way down to the cervical spine. Right here at the base, you're going to get a lot of headache patients or clients. So Feel that hop a little bit?
Yeah.
Yeah. See that hop, if you see it on camera, that's kind of the area right in here you want to be on. And turn them into, does that hurt or are you okay?
No, okay.
Kind of like a good pain still, or?
Yeah.
Good. And remember, you don't want to not hurt your hands, so that's why I use her body to pull towards me. If I wanted to do more deeper pressure without having to hurt myself, I could lean in and have her turn towards me. We won't do that right now. All right. Next we're going to do a stretch. That's going to help stretch and lengthen the scalenes. So we're going to lift her head up. I'm going to come under. I'm going to turn her head. I'm putting her on the top near my elbow. I'm pressing down right below the clavicle and leaning straight back this way. You feel that?
Mm-hmm.
Hurt, feel good, and different?
Feels good.
Okay. Remember with the neck, you don't want to push it too much. You don't want the head to pop off. That's a joke. They didn't laugh that time. But if you feel right here, first rib, press into that. And then now, you feel that more?
Yeah.
Yep. So, and back, kind of in and out, and to help that muscle relax. Before we move on to the next muscle, I did want to show the same. If you put your hand in a hook formation like this, imagine the spine being in the middle. You're going to want to do both sides, but put the spine in the middle of that. I'm all the way down close into the thoracic, and I'm sliding all the way up. And down, and up. And most people will say this feels pretty good. What would you say?
Yeah, it does.
You could just do that the rest of the hour.
Yeah. I do this my whole shift.
She's getting paid for this. All right. And then same thing on the other side. All right. Next, what I'm going to do, we're going to show some pectoral muscle work. So, drape your arm around. All right.
I don't know where you want me.
Let's stand over here for now. Sorry. Just making sure we were covered and all that stuff. We're going to turn her away from camera. All right. So we want to put some lotion on our pecs. Remember, when you're working the pec major, you're going to find a lot of tender points all throughout. There's a lot of trigger points with the pec major. Ooh, she's like, no, that hurts.
Oh my god.
Okay, so we will lighten up. All right, I like
No,
to...
it's because it's ticklish.
Oh, it's ticklish. Okay, sorry. So, and that's a prime example. What you can do in this situation if it's ticklish is put a bigger body part on her, like a forearm or a fist sometimes. But what I like to do is put their arm along my hip. Now I can lean back at the same time and pushing. Push. See how I'm turning my wrist? Can you see?
Mm-hmm.
Along the clavicle. Does that feel pretty good?
Mm-hmm.
All right, next. Just don't elbow them in the face. You can come over here and get right on top. Does that tickle at all?
No.
Okay. And again. You need to see where I'm at. I'm right here. You'll feel that tendon or the muscle band right here. Not you.
Oh, sorry.
She's just overly helpful. All right. We're gonna... Good. And then what I'm also going to show, I'm not going to do it on video, but it's what I would sometimes do, not every time. This is just, let's say you couldn't get that pec to release, or they have anxiety issues, or they have breathing difficulties. I like to work on the sternum area. Now, how I would do it, I would interlock my fingers at the sternum point and then press and push out. Make sure you always get the client's permission before you do this. Basically, and you kind of be here and then get some lotion on your fingers and just kind of push out all the way through. And it gets really tender, but it helps release that whole pec major. Okay. Next, we're going to go into the pec minor. All right. So, wherever you feel that tight band right here, you can come under that and slide forward. Feel tender?
Mm-hmm.
And that's one good way to know if you're in the right area. If you feel a little bit tender, one way you can help it not be as tender as well, if I wanted to hit that spot, or I can do it with my thumb and put my whole hand in the area too, so that it spreads it out so that they don't feel the tenderness as much or the ticklishness. All right, and then after you work that out, you can also do some active or passive, release techniques. You can come under their arm, and press into their pecs, and then have them kind of go like that, and then come back and hold the pressure. That'll help open that up as well. And also do the opposite, press in and have them push down. Next, we're going to hit the subscapularis. So, and part of the lat, but so through here, you're going to see the shoulder blade. We try to get the bottom corner of the shoulder blade will be a little tender. That's a good trigger point, and then right in the meaty part. So, I personally like to do it with my elbow, and that's just to cover more area because a lot of people are ticklish. So. Take her arm up here, props it up, slide under. May take some practice on for you guys. So feel a little bit.
Mm-hmm.
Not bad, tender. How do you feel?
Not bad.
Not bad. Okay, and you can actually lengthen back as you hold that pressure, and then relax, and then I'm going to sink into the meatier part right here. Not into the armpit. All right, this will be a little more tender usually. How's that?
Yeah, just a little bit though, not that much.
Well, again, I want her to want to come back to work, so. Good. And we'll go across. Last thing we're going to do face up. You can get these trigger points on the Infraspinatus and Teres minor. You kind of feel around. Once you feel that tight band, right? Yeah, you got feel that.
Yeah.
Now, if I don't try to don't hurt your thumbs. Put one over the other palm and lean in. You'll get a lot more pressure that way, or stabilize your thumb and pull her towards you. I've actually decided we're going to break this up into segments. I'm going to do, this is part 1 of our videos. We're going to do part 2 and do the sideline on that video, and then the next we're going to do a lot of face down upper back work with cupping included. So I hope you all enjoyed this. Please hit subscribe, like our video, let me know what you think, as long as it's positive things. I'm just kidding. I always take any feedback. It's always appreciated. All right, so y'all have a great day. Follow us on Instagram and TikTok as well.